Now to a health alert, as a case of the measles has been confirmed in our neighboring state of Vermont. Western Mass News reporter Madison Lasowski has a look at the data surrounding measles cases here in the Commonwealth to find out if we should be more concerned.
Measles cases have been a big concern recently, especially in Texas, where there have been 25 new cases since the end of last week, with 29 currently hospitalized. 97% of those cases are not vaccinated or had unknown vaccinated status. Now, the measles have made their way to New England. Health officials confirmed a case of measles Tuesday out of Lamoille County, Vermont. The school-aged child allegedly got sick after traveling internationally, and it is unknown whether the child was or was not vaccinated. Even though that case was unrelated to the outbreak down south, we wanted to take a look at the number of cases here in Massachusetts over the years. According to the Massachusetts Department of Public Health, we have had a total of 70 confirmed measles cases since January 1st of 2004. As you can see, the cases have been minimal besides the spikes in both 2006 and 2011. As for 2025, the current number of cases in the United States is up to 222, with 94% of those infected being unvaccinated. Earlier today in Springfield, Health and Human Services held a meeting discussing the apprehension surrounding the measles outbreak across the country. This to reassure those in the Commonwealth.
What we're watching across the country is very concerning. But it's also, we also should remember that about 92% of those individuals who are contracting measles are unvaccinated.
The growing outbreak in Texas raising concerns locally about how susceptible you may be, especially if you're traveling to Texas or internationally. Health officials are urging Americans, especially children, to get vaccinated against the measles because while it can be prevented, there is no mainstream treatment. Reporting for Western Mass News, I'm Madison Lasowski.
Still ahead.